We are all about facts, not fear.
That's
Al,
right.
you know that, and providing information to keep you and your loved ones safe. Dr. Payal Kohli joins us live. How are you?
Hi, Sam. How are you?
We are doing, you know what? Today's an emotional day.
Yeah, we have to be honest. That's all we do on the show.
Today's an emotional day, Dr. Kohli. Speaking about George Floyd, also our nation has reached a dark milestone today, 100,000 deaths in the United States as the result of COVID-19. Well, according to NBC News, the truth is, doctor, even when this number is scaring people, we've talked about it over and over and over again on this show, but people are sick and tired of staying at home. So my question to you is, how do you cope with what's being called quarantine fatigue?
That's a great question, Sam. And quarantine fatigue is real, and it's really no joke. And I have to be honest with you guys, I feel it too sometimes. I want to see my friends, I want to travel, I want my life to go back to how it was. And some days I just want to get out there and say, let's just see what happens. But you know what? As you said, the price is human lives, 100,000 human lives already lost. So really you have to make a list of what gives you joy and try to do it during this quarantine. So let me give you an example. If going out to movie theater makes you happy, you have a popcorn party at home, make popcorn and have a Zoom party with your friends. So find ways to do what gives you joy in a way that's safe and sustainable.
I love it. Now, Doc, obviously we love having you on, but we bring you on to help clarify some confusing stuff that we see in the news. So last week we talked about the CDC changing guidelines about the virus being transferred on surfaces. And now they're walking that back some. Can you tell us what's going on?
Yeah. So the guidance, Al, was really intended to make the language less confusing. There was no new science, no new data, nothing new about how the virus transmits. But what they did was just end up confusing people more. And that's part of the reason they walked it back. So the bottom line is nothing has changed. The primary mode of transmission is person to person through droplets. The secondary, less primary mode of transmission is through surfaces. So the back and forth was really intended to clarify the language. And unfortunately, all they did was confuse people.
Great.
No, that
well,
helps.
Thank you for clarifying, Dr. Kohli.
Thank you for clarifying the confusion from the previous confusion.
Before we go, it is time for Dr. Kohli's Silver Lining. We all need it today. Yep. And today you want to talk about the changes in higher education.
Exactly right. So this pandemic has actually made higher education more accessible, something we never would have expected. So when it all started, I was really worried that it was going to affect the college admissions process, the SATs, the ACTs. But in fact, what data is showing is that U.S. colleges have actually made college admissions easier because of the pandemic. So people are more likely to get into college. And there are also places like MIT that are actually now putting some of their courses online for free. So people can have access to that education, that higher level of education for free, and not have to pay the thousands of dollars in tuition that I paid stupidly to MIT.
Your alma mater, correct?
That's right.
Thank you, doctor. We appreciate you. You will be back tomorrow. If you, D-Mail Nation, have a question about coronavirus you want answered by Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com. No panic, just prevention and precautions. Right.